Everybody to Go Local Live. I'm Josh Fenton, CEO and co-founder. Thanks so much for joining us on this fallish day of about 62 degrees, overcast, and very, very wet on the ground after Rhode Island and the entire Northeast getting just hammered with the remnants of the hurricane. The death numbers, death toll is, according to the Wall Street Journal about 15 minutes ago, is up to 17 in the New York, primarily in the New York, New Jersey, and Pennsylvania area. To date, no deaths have been reported in Rhode Island. One road in Portsmouth was undermined and collapsed because of the heavy rain. So more coverage on this as an assessment is done on what the total implications are of this storm here in Rhode Island. Let's go to Dr. Michael Fine. He's the former Director of Health for the state of Rhode Island. Dr. Fine, thanks so much for joining us.
Great to be with you, Josh.
Okay, we don't have new numbers from the Department of Health yet today on the coronavirus, but we do have the numbers yesterday. And the numbers yesterday showed hospitalizations continue to creep up. I think it's the highest number since the very beginning of May. And the transmission level, I think that's the highest number we've seen in months and months, 205 cases per 100,000. Your thoughts where we are here at the very beginning of September? Schools are beginning. Some people are coming back to work. Arts organizations are reopening. Theaters are reopening. It's all starting up again.
Yeah, well, the data shows at least a little plateauing, as we've said, though it's a plateauing with a slow, consistent rise. So the number of hospitalizations fell a little bit last week. That's a good thing. But what's unpredictable is where we go from here. With schools reopening, with businesses happening again, it's the beginning of the Jewish holidays in the beginning of next week, so people will be coming together, though I think people have been warned to do that carefully. This is the opportunity for a much more transmissible Delta variant to be transmitted. I'm hoping that all the precautions that schools are taking will help, but remember, the bulk of kids haven't been vaccinated. And so I'm afraid that we may see, a jump up again 2 to 3 weeks from now from this plateau, and to see us go from 205 new cases per 100,000 per day on fairly limited testing to something like 400 to 500 or more new cases per 100,000 per day.
Yeah, I mean, the testing right now is happening at the colleges and universities. It's not happening amongst the public here in Rhode Island. It's the colleges who have had pretty consistent, high quality, logical testing strategy. Pretty much everybody's got to get tested twice a week, students as well as faculty and staff, in order to be on campus. And you look at the number of tests going on at Brown and PC and URI, et cetera, and it looks to be about a third or more of the total testing going on in Rhode Island.
And so that means that there's a lot of testing not happening. Now, I learned something interesting yesterday from talking to a RISD faculty member, and that's that apparently they've changed their testing strategy some and are only testing vaccinated people once a week now, not twice a week. Time will tell if that's a wise choice or not, given the breakthrough rate, which new data suggests is 16 to 20% or more. That is, vaccinated people can carry the disease. The other thing that I thought was interesting that RISD isn't doing is that it's not exempting people over 65 and people with chronic disease from being in the classroom. So that means that even vaccinated people, 65 and over with chronic disease, are in the classroom teaching. And I worry about that because if that group of people contracts the virus as a breakthrough, they are at significant risk for hospitalization and death. With widespread, with a high level of community transmission, I think you got to play the game differently. And yet I think people are, treating this like it was a year ago, pretending that Delta is Alpha, which means, I'm not sure people can spell or at least count. I think that sets us up for trouble. This is a much, much more transmissible disease. Remember, one case likely turns into 8 cases, which then turns into 64, which then turns into 128 very quickly if you're not exceptionally careful.
Dr. Fine, we finished August with 30 deaths in Rhode Island. It certainly was nothing like what we saw the carnage in November and January and February, when we saw on average about 400 deaths per month. But if you go back a period of time, pre the pandemic and maybe pre the opioid overdose cycles that we've seen in the past few years, the idea of 30 people dying of a specific cause would just send everyone into a frenzy. We are really just becoming very comfortable living with 30 deaths, not as bad as 400.
Yeah, I'm not so comfortable, to be honest. And what I fear is that, we went from 6 or 7 deaths in July to 30 deaths in August. I'm pretty sure we're going to see 50 or 60 deaths in September. And the rate of transmission will tell us what we're going to see from then on. And Josh, in my view, most of these are preventable deaths. If we had jumped in July, when you and I talked about it, and changed what we were doing, I think these are deaths that can or should have been prevented. And somehow, people are shrugging their shoulders. They shrug their shoulders until it's their father or their son or their cousin. And all of a sudden, then they wonder where everybody was and why somebody didn't do something.
Yeah, I think it's, whatever it is, exhaustion by the pandemic, no longer wanting to focus on it. It's uncomfortable. There's no good news there. Excuse me. And so there's kind of a tuning out of it. But it remains 30 deaths. I mean, it's from one source, one cause is a significant number. No, it's not 400, but it's a lot more than 5 or 6 in July.
Yeah, and I think where we're at is that in September, if not in August, the number of COVID deaths will be greater than the number of opiate overdose deaths. And so the opiate overdose deaths have become second on our list, but that's no success. It's a failure. It's not that we got opiate overdose deaths less. It's that we let COVID get out of control again.
Let's talk a little bit about the flu. Last year, functionally, we had no flu. There was so much social distancing. There's so much mask wearing. There was so much hand washing. There was so much hand sanitizer. Do you have any insights into what to expect this year and when people should get a flu shot?
Well, I think if people spend time together again, we can expect more influenza. Generally, influenza moves from west to east, and we haven't begun to see it yet in the west. Usually doesn't show up until November or December. So we'll see what happens and, whether we get another building flu year or not. Typically we vaccinate 40 or 42% of the population. I don't know where we were last year. I think perhaps a bit better, but certainly this is the year to vaccinate the entire population. Not that people have been, enthusiastic enough about vaccination for COVID, in my view, but the opportunity to start is to start in October. That I think the actual best time to get vaccinated is the end of November, because it takes about 2 weeks, as we've learned with COVID, for the vaccine to become effective, and that gives most people protection against the flu by the middle of December, when the virus typically spreads. There's usually lots of spread with Thanksgiving and Christmas, So certainly we want to get people vaccinated by that time. And boy, would it be nice to see, 80, 90, 95% of the population vaccinated, and then we could prevent flu again. We typically lose 100 to 300 people from flu each year. We didn't see very many flu deaths last year, thank goodness, but way too many COVID deaths. It was kind of a trade-off. But boy, would it be nice if we could really roll up our sleeves and keep people dying from both flu and from COVID this year. Doesn't look like the latter is going to happen. Doesn't look like we have enough resolve. And boy, would it be nice if we could at least keep flu at bay while COVID is running rampant.
Yeah, I haven't seen any public education on it yet. I think the Department of Health, whatever communications is outbound, which I don't see much anyhow these days. Beach closings, a lot of press releases on beach closing and beach reopenings. Not a lot of communications on vaccinations, either for the virus or for the flu. So if you're keeping score over at the Department of Health and their press releases, it is beach closings and openings about 100, and vaccine and flu vaccinations in the last few weeks, 0.
Yeah, and this is usually the time when the department would start to ramp up the communication about flu vaccine, usually aiming for an October 1 release date. So let's hope that they get that done. There's a huge opportunity this year, which is it's believed that boosters will be released on about the 20th of September. And wouldn't it be nice if everybody who got a booster for COVID also got a flu shot at the same time? But I think we need a whole lot of ramped up public communication to get people sort of charged up and ready for that. And I'd love to see that ramped up communication start, if not now, then right after Labor Day, which is obviously next Monday.
Yeah, that's 3 weeks away on the booster shots. Obviously, there's not quite clear guidance from the CDC or the FDA, and especially from the Department of Health, who I think is waiting for that on the flu, and 0 communications that you could go in and get your booster or even your initial vaccination shot and get your flu shot on the same day, and what the implications of that would be. There's been 0.0 on that as well. Interesting.
Yeah, let's hope it starts right after Labor Day and is done with great enthusiasm and intensity, so everybody, sort of gets together and gets this done.
Yeah, I was out early this morning on this crisp fall day, so I was pretty much thinking that it was past Labor Day this morning when it was in the high 50s at 6 a.m. this morning. Dr. Fine, if we've talked about going back to school and what the implications are, I'm sure we're going to have this discussion a number of times over the next few weeks. For parents, what should they be looking for? What should they be asking about? And what should they be demanding?
Well, I think parents should be making sure that there are both mask and vaccine mandates. That's the best way to protect spread at school. I think parents should be demanding twice weekly testing in our public schools the way we did in our colleges. I think our public school kids should be treated just as well, if not better. They are our future. And twice weekly testing, and then the closure of specific classrooms or schools when there's an outbreak is an important part of any strategy. That's the way to keep this under control. Sort of hoping, praying, demonstrating, all that's not going to change it. And what's going to change it are those very specific public health strategies.
Dr. Fine, you get the last word. In general, what should people be looking for?
Well, I think people should be looking at reducing their contact with others right now until we get a lower level of community transmission. That's a number we need to be focused on. We were 205 yesterday. We need to be below 35, in my view, to really contain this disease. We got a long way to go about that.
Dr. Michael.
One other brief last word. and that is Lashana Tova Tika Tevu. To anybody who's going to be celebrating Rosh Hashanah, may everybody be inscribed for a sweet and happy New Year.
Thank you, Dr. Fine. For everybody else, stay tuned. Lots of updates. It is not quiet in Rhode Island at the end of the summer. It is busy, busy, busy in all fronts. If you haven't gotten vaccinated, time's up. Get over there. Get it done with your doctor, with your healthcare center, with a CVS or a Walgreens. It doesn't matter. Just get it done. You'll feel better. You'll be healthier, and you may stay out of the hospital or even worse. Thanks, everybody.
Thanks, Josh. Vaccinate, mask, and test. Vaccinate, mask, and test.